We're going to talk about chapter 3. This is the third time I've started this. The dogs had a barking fit the last time I tried to do this. So I tried to do this earlier in the week and I didn't turn on the recording. So now I think I'm okay. I hope I am anyway. So here we go. We're going to talk about chapter 3, which is has to do with being birth and being a neonate. We covered this last time. First stage of delivery is the longest and typically lasts 12 hours or more. In first children, the first stage is longer and becomes succeedingly shorter the more children a woman has. This stage involves contractions of the uterus, causing the tiny hole in the cervix to expand enough to allow the bulk of a baby to pass through. And these are the sonometers that they're talking about. The second stage of labor typically takes 1.5 hours or less. This stage begins when the baby's head begins to move through the cervix and into the vaginal canal. The stage ends when the baby completely emerges from the mother's body. If this stage lasts longer than 2 hours, the physician may use some form of assistance to extract the infant. The methods that I have seen, they use a suction pump to grab a hold of the baby's head and pull it out. Usually it causes some bruising, minor bruising, but it usually doesn't hurt the baby. Or they can use forceps. They don't like to use forceps because sometimes they can damage bones. The baby's fairly flexible at this stage. As when they pass through the birth canal, the head, of course, there is a soft spot in the top of the head. This is because the skull plates are not fused together. They're relatively malleable. And normally what will happen if the baby is born from a natural childbirth, of course, the baby's head will become relatively thin because it presses itself into a cone shaped, and it will pass through the birth canal. That's if it is. This is the proper position for a baby to be in when it is born. The chin, it's the top of the head that presses through the birth canal. Well, right where the crown is the part that normally pushes through first. The reason is because the baby has its chin tucked up against its chest, making it as small as possible. If the baby isn't in this position when the mother goes into labor, then sometimes they'll have to turn the baby. A breech birth is usually far more difficult because the pelvis, of course, isn't flexible like the head is, like the skull is, and it's a little bit more traumatic for both the baby and the mother. Certainly, the mother. Sometimes it'll present with its legs first, and this is not good either because the pelvis is not flexible, and if only one leg comes through, then it doesn't. Then that may potentially damage the pelvis, the baby's pelvis. But usually the doctor can get the baby turned. If they are in a hospital, they will probably do a cesarean birth um, in order to make sure that the baby isn't injured during the delivery. And in some countries, cesarean births are very, very common, and we're going to talk about that in just a second. But this is the proper position for the baby to be in. The third stage lasts for 5 to 30 minutes and involves the placenta and the umbilical cord being expelled from the mother's body. This was previously called passing the afterbirth, but of course we've changed the names because some people didn't like it. The fourth stage involves a recovery process where the baby and the mother both rest and their condition is monitored. Cesarean birth is fairly common in some areas of the world. I'm going to show you where they are it is the preferred method of delivering a baby, not natural childbirth. These are the incisions that they make. This is the old incision, was a vertical incision. It was relatively long. It started right under the umbilicus and went right down to the pubic bone, and they pulled the baby out that way. Some women complained they didn't like the idea that they had a scar across their abdomen, so they started using this horizontal incision right above the pubic bone. This is also known as a bikini cut because it is usually hidden under a bikini bottom if the woman is swimming somewhere. So they'll make the incision and then pull the baby out. Both of my children were born cesarean. My wife had a fairly small pelvis that wasn't very flexible. Actually, my grandson was born cesarean birth, even though my daughter was determined that she was going to have a natural childbirth. Her pelvis wasn't very flexible either, just like her mother's. Anyway, uh, both of them, both my wife and my first wife and my daughter had cesarean births. And if we look at this, this is where cesarean births are popular. Australia, Brazil is the #1 country. Over 75% of the childbirths are done by cesarean delivery. United States, Mexico, that's Puerto Rico, isn't it? I think it is. Yeah, it's Puerto Rico. Or is it Haiti? No, that's Haiti. This is Puerto Rico. Uruguay, Paraguay, that's Iran, that's Turkey, and this is Italy and Switzerland and Germany and Poland, and that's Slovenia and Romania and Bulgaria, I think. Historically, childbirth has been kind of mysterious. Before the 15th century, midwives did most of the delivering of children. Into the 15th century, the 1400s, this was the Dark Ages. They decided that midwives, because they used all these herbs and medicines, that they were witches, and that the only reason that they knew about all of these magical substances is because they were in league with the devil. So midwives became, well, they hid um, because they were considered witches. Some of them were of course, killed, executed. Into the 18th century, medical schools and physicians began delivering babies. And in the 1700s, the field of obstetrics was born. And I don't know why that keeps popping up. There we go. 20th century, doctors not properly trained to handle childbirth, and this was a problem. We're not exactly sure why. Into the 19th century, doctors did deliver babies, but then in the 20th century, they stopped teaching them how to deliver babies for some reason. Because they weren't really very good at it, they started using more and more drugs because of all the complaining during the childbirth. But then later on in the 20th century, they started doing natural childbirth again. People are kind of weird. My mother had babies between 1944 and 1954, and she wasn't awake for any of the 6 children that she had. They knocked her out as soon as she came in to the when she started labor. They just knocked her out. The next thing she knew, she had a baby sitting on her chest somewhere. With hospital deliveries, there's no difference in maternal health or neonatal outcome between natural childbirth and medical methods. Now what they do in hospitals is if the mother wants it, they allow her to go into labor, and they try to deliver the baby through natural childbirth. If that doesn't work, then they use other medical methods. If she wants to be knocked out, they knock her out. If she wants a cesarean birth, usually they will just do the cesarean birth and not bother with the rest of the natural childbirth. They don't force them. Okay. Celebration of birth. The Illa of Zimbabwe praise women and they offer them gifts. That's in Zimbabwe. Fear or weariness of birth. The Arapesh of New Guinea only allow birth on the outskirts of the village in a place reserved for menstruation activities to prevent the village from being contaminated. Of course, if it ever is contaminated, then they have to move the village because of the contamination. And of course, that is the Arapesh of New Guinea. Cultures may have purifying traditions for mothers after she gives birth. The Jewish people do this. The Jewish people have to cleanse women after they go through menstruation, and they also have to purify her after she gives birth. Placenta may have some special meanings. Some cultures bury the placenta in a sacred place. Some cultures believe it has value for hormones and nutrients, and of course, the Dene people have very special feelings for the umbilical cord. Attempts to ease birth process include abdominal massage and herbal teas, herbal medicines to cope with pain. Midwives give instruction and encouragement. They may have symbolic symbols placed around in the room where the woman is giving birth to protect the child and to protect the mother. Emotional and social support is important for the birthing process. Medical use of epidurals is seen in developed countries to take some of the pain away. Birthing position also eases the pain. What they have discovered in other countries is that an upright, semi-sitting, and half-reclining position is the best for childbirth. Placenta is delivered through various methods, and of course the umbilical cord may be cut and tied depending on the culture. And these are birthing chairs. This is an old, traditional birthing chair from Europe. This is actually a Swedish birthing chair, modern birthing chair, and as you can see, it's fairly sturdy. The woman sits in this portion right here, and she holds on to the rings. These are stirrups for her legs to hold her legs apart while she's giving birth. Maternal mortality, deaths of mothers per 100,000 live births. As you can see, sub-Saharan Africa, this is the Sahara Desert right here. Sub-Saharan Africa has very high maternal death rates. The highest in the world is in sub-Saharan Africa. Complications of childbirth. Birth trauma may be caused by anoxia, and if you look at this word, an means not, and oxia means oxygen, no oxygen, oxygen deprivation. Diseases, infections, or physical injuries. Low birth weight babies fall into two categories, preterm and small for date, and we'll be talking about that in just a minute. A low birth weight baby, if necessary, is placed in an antiseptic temperature-controlled crib known as an incubator and fed through tubes. 50 years ago, the leading cause of death of intellectual disabilities in the United States was a condition in some neonates that did not allow them to metabolize protein properly. This condition caused a buildup of phenylketonuria, which is the waste product of protein metabolism. It allowed it to build up in the blood. And the problem was that in almost everybody in the world, they are able to break down this phenylketonuria, but because of a genetic mutation, there are select individuals that cannot metabolize this waste product. Now, by screening all babies at birth, phenylketonurics can be placed on a special diet, and live otherwise normal lives. And what has to happen is that the baby's blood is drawn as soon as the baby eats their first meal of protein, which is milk, of course, and they check the phenylketonuria in the blood, and if it's too high, of course, they'll put the baby on the special diet. There are other developmental problems, hypothyroidism, if the baby has a problem with their thyroid, and galactosemia. We talked about that last time. It actually does smell like maple syrup. And we screen these, of course. In some places, they screen for all three of these. In other places, they just screen for PKU, phenylketonuria. Infant mortality in select countries around the world. Iceland has the lowest infant mortality. You can see the United States is way down the list, below all of the Scandinavian countries. Most of these are European countries, except for Japan, of course. If we look at these, one of the things we realize is that all of these countries have universal health care, which the United States does not have for some reason. They passed Obamacare, but it wasn't universal health care. And there's actually no reason why we don't have it. Just doesn't make any sense. Highest infant mortality rates are all in sub-Saharan Africa, except for Afghanistan, is in South Asia. These are all sub-Saharan countries, and as you can see, infant mortality rates are very, very high. Infant mortality rates around in the developed countries relatively low. These are all European countries, and these three, Singapore, South Korea, Japan, and Hong Kong, are in South Asia. United States is a little bit higher. Oh, Japan, Hong Kong, Norway, Singapore, South Korea, and Sweden have the lowest infant mortality. United States about twice as high as South Korea, Japan, Hong Kong, Switzerland. Low birth weight is less than 2,500 grams or 5.5 pounds. Very low birth weight is less than 1,500 grams, about 3.3 pounds. Extremely low birth weight, less than 1,000 grams or 2.2 pounds. Causes of low birth weight in developing countries, it's usually malnourished mothers and a lack of prenatal care. This is in developing countries. In developed countries, it usually has to do with cigarette smoke, and there's a reason for that, and we'll go over that in just a minute. Overall, multiple births, maternal age, and drug use can also cause low birth weight babies. Consequences of low birth weight, high mortality rate, unfortunately, low birth rate for small to date infants, poor maternal malnutrition, illness, or exposure. This is what a baby looks like in an incubator. This is a immature, this is a preterm baby. As you can see, he's not very well developed. Low birth rate for preterm neonates, inadequately developed physical systems. Their lungs are immature, so we have to keep this as an oxygen-rich environment. Their immune system isn't up to snuff, so they are very susceptible to diseases, and their central nervous system isn't developed yet. So we have to keep them in the incubator, sometimes for an extended length of time. Rates of low birth weight around the world, percentage of live-born infants that weigh less than 5.5 pounds. And as you can see, sub-Saharan Africa, once again, is one of the more dangerous places to have a baby. Also, low birth weight is very common in India. And this is Indonesia over here. Treatment of low birth weight infants include kangaroo care, which is skin-to-skin contact for 2 to 3 hours a day. and infant massage. It's really kind of an interesting picture because, as you can see, the mother is much darker than the baby. The reality is that babies don't always develop very much melanin. You can usually tell if a baby is going to have a darker complexion, but most babies are right about that skin tone. So no matter how dark they're going to be when they get older, usually they're right around here. That's about it. And potentially this child will be as his or her skin tone will be very similar to the mother's, but when they're born, they haven't developed the melanin in their skin yet. Even with assistance, low birth weight babies are at risk developmentally. The average baby born in the United States is 20 inches long and weighs about 7.5 pounds. 95% of all full-term babies weigh between 5.5 and 10 pounds. They are between 18 and 22 inches long. Firstborns tend to be lighter than laterborns. Boys tend to be slightly heavier and longer than girls. The first few days, the neonate will lose about 10% of its body weight. Most of the weight is fluid buildup that the baby accumulates in the uterus for insulation after birth and padding coming through the birth canal. The baby will begin gaining weight back by the 5th day and are back to their birth weight by the 10th to 14th day. The last baby that my mother had, my brother, when he was born, he weighed 13 pounds. He was huge. And the reason was because her gestation was, instead of being 9 months, was 10 months. She thought it was because she was starting to go through menopause and that her hormone level wasn't high enough to allow him to be born in 9 months. So he was in there for 10 months. And when he was born, he was huge. Well, 13 pounds is pretty big. And my mother wasn't very large. She was only 4 foot 8 inches tall. And when she wasn't pregnant, she weighed just right around 100 pounds. But he was her 6th child. So when he was born, as I said, he was huge. My mother said that the first time she saw him, he looked like he was one of those kids in a snowsuit, and they've got their arms stuck straight out, and their legs are straight out, and they can't walk. That's what he looked like. He looked like he was just full of water, and he lost down to 7 pounds, I think. That's if I remember correctly from what she said. But she said he had to change his diaper almost continually because he was just drawing off water just almost all the time. Anyway, so by the 5th day, they're back to their birth weight. He wasn't, of course, because he was a little bit larger than he should have been. Medical and behavioral screening, 1 minute after delivery, and then again 5 minutes after birth. Most babies are assessed using the APGAR scale. An infant's score may be affected by the amount of medication the mother received. Neurological or cardiorespiratory conditions may interfere with one or more of their vital signs. Normally, and I've been in on lots and lots of births, even in Children's Hospital, where we were expecting bad deliveries or problems with deliveries. Almost all babies that were born, probably 97, 98%, were their APGAR scale was pretty good at birth, unless they were premature. If it was a normal delivery and they were full gestation, normally there was no problem at all. They just started crying almost right away, and that's exactly what you want them to do. You want them to start moving and crying and being aware of what's going on. The APGAR scale was developed by pediatrician Virginia APGAR, with APGAR a quick reference to determine the state of the neonate. They're looking at appearance, they're looking at pulse, They're looking at the facial expression of the baby. They're looking at the activity level of the baby, and they want the baby, of course, to be breathing. So if all of that takes place, then they get a 10. Normally, you don't really see a 10 because sometimes they're not moving around very well, so they give them a 1. But as long as they're crying, usually we're in good shape, and that's one of the reasons why the old cartoon shows the doctor spanking the baby. That really doesn't happen. Normally, they will just rub the baby and try to get the baby to respond. They're trying to irritate them enough to make them to make them a little bit angry. It's really kind of interesting when these guys are born. They've got a mean look on their face. They're going, "What in the world is happening?" You can see the look on their face, and that's good. You want them to be grimacing. You want them to cry because that will clear their lungs and it will pump blood through their body. Um, they'll be nice and pink, and everything will be perfect. 98.6% of neonates, excuse me, will achieve an APGAR. I've got the hiccups. Will achieve an APGAR scale of between 7 and 10 within the first 5 minutes of life. Any score below 7 and the neonate is given assistance breathing. Any score below 4 and emergency measures must be applied. If breathing is established or restored, no permanent damage may occur. So we have a little bit of time. We have about 10 minutes to get the baby going. Usually it's the 5-minute mark that is the most serious. Like I said, well, 98.6% is a lot. That's almost everyone. And that's normally what you will see. The baby will be, everything's great. But the 5-minute mark is the point where you start doing things with the baby, putting them on a respirator, heart massage if necessary. Medical and behavioral screening. The Brazelton Neonatal Behavioral Assessment Scale assesses neonates' responsiveness to their physical and social environment to identify problems in neurological functioning and to predict future development. Of course, you don't do the Brazelton Neonatal Behavioral Assessment Scale until the baby has been out and about for about, I think the first time you do this, depending on what the doctor saw in the hospital, they can do it weekly. They can do it. Usually, it's about a month. They come in for their 1-month checkup, and that's when they'll do the Brazelton. They'll do the Brazelton every time they come in, just to make sure there are no problems. They don't want to miss anything. The baby is born with elementary survival reflexes that may reflect back to humans as more primitive creatures. There are primitive reflexes, and I'm going to show you a video of them in just a second. The moro or startle response: when the baby is dropped or hears a loud noise, it extends its arms, legs, and fingers and arches its back and draws its head back. Let's do the APGAR scale first. They're going to go over what I just talked about. For some reason.
Flowbent, the company you probably don't know, behind many of the digital transformations you do know.
The APGAR score was invented in 1952 by anesthesiologist Virginia APGAR. It is a scoring system ranging from 0 to 10 and is calculated by evaluating the newborn based on 5 criteria. Each of these criteria can be allocated a score from 0 to 2, and then the sum of these criteria will give you the total APGAR score. In the original article published by Virginia APGAR, the original components of the score were color, heart rate, reflex irritability, muscle tone, and respiratory effort. However, there is an easier way to remember these criteria by remembering the mnemonic APGAR for appearance, pulse, grimace, activity, and respirations. Typically, the APGAR score is calculated at 1 and 5 minutes after birth. If the score is low, you usually repeat the score later. A score of 7 and above is generally normal. Scores less than 7 are low and suggest distress of the newborn that requires some intervention, for example suctioning or stimulation. Although APGAR scores are not used to determine morbidity or mortality, lower scores are typically thought to correlate with more severe outcomes. For example, scores of 3 that are persistent can indicate long-term sequelae such as neurologic damage. However, ultimately, the purpose of the APGAR score is to determine when emergent interventions are necessary. The APGAR score is as follows. You will take a look at the newborn's appearance. If they are blue or pale, you give them 0 points. Blue extremities but a pink body, you'll give them 1 point. And you will award 2 points if the body and extremities of the newborn are pink without any cyanosis. For pulse, if it is absent, you score 0 points. If the pulse is less than 100 beats per minute, you'll score 1 point. And in the ideal situation, the newborn's heart rate should be greater than 100 beats per minute, awarding them 2 points. For grimace, you award 0 points if there is no response to stimulation, or the baby is floppy. 1 point is awarded for grimace on suction or aggressive stimulation. And again, ideally, if the baby is crying on stimulation, you award them 2 points. For activity, if the newborn is not moving, you of course award them 0 points. If there's some flexion of the arms and legs, you award them 1 point. If there is active flexion against resistance, you award 2 points. For respirations, if they're absent, you award 0 points. For weak, irregular, or slow respirations, 1 point is awarded. And if the baby is strongly crying, you give them 2 points.
Okay, let's do the other one. The other one's kind of interesting too. Primitive reflexes. This is from England, so they're accent may be a little stronger. Newborn baby.
All
Neonatal.
full-term newborn babies are born with some natural reflexes, including sucking, walking, holding, and the startle or morrow reflex. If all these reflexes are present, the parents can be reassured that their baby's development is normal. This will not be the same in premature babies, as they still have some way to go. Following the birth of the baby, the midwife or paediatrician will check for these reflexes. Victoria's newborn Esme is being checked out by her midwife Andrea, and she shows how her legs already know how to move in a walking motion. Consultant neonatologist Ryan Watkins is checking over 3-day-old baby Tamami.
So you can see her legs are flexed and moving normally, and her arms are slightly flexed as well. It's a bit unfair to expect this one to flex too much given the weight of the cannula. And you can see, and she's a newborn baby, her central tone is low, so she arches over my hand. The baby who's a month or 2 old, you'd expect that to be straighter and trying to lift her head. What I can do then is just check her morrow reflex, and to do this I just drop her backwards into the palm of my hands. It appears a little bit startling, and the startled reflex is another word for it. Whee! So you can see her fling her arms out to the side and open her eyes, and then they return to the normal position. If I open her hands up, place my pad of my thumb in the palm of her hand, and you should find that she grips my fingers. And the same thing will happen on her feet. She's flexing her toes there. You can check it's symmetrical by looking at this side too. She's very alert just now, isn't she?
These reflexes will disappear over time as the baby develops and becomes stronger.
Okay, that tube you saw sticking out the baby's nose, those are feeding tubes. And both babies that they showed had IVs in their arms. That's a little strange. But you saw the bandage on the baby's heel. That was from the PKU. They had to draw blood in order to check the baby's PKU. And I'm not sure what the rules are in England but they may have checked the baby for hypothyroidism and galactosemia. Okay, now we're going to go over what we just saw. Darwinian or grasping reflex: when the palms of the hands are stroked, the baby will make a fist and is even able to support itself. That's what he was doing when he was pushing on the baby's palm. The tonic neck reflex, we didn't see this one. When the baby is laid down, it will extend its preferred limbs in a fencer pose and flex its non-preferred limbs. And of course, this baby is right-handed because you can see it's sticking its right arm out. Rooting reflex: when the mouth or the cheek is stroked, the baby will turn toward the stimulation and begin a sucking response. The first time I ever went into a nursery, the nurse was showing me this. I don't know why she was doing it, but she stuck her finger up there, and the baby grabbed a hold of it and started sucking on the nurse's finger. The walking reflex, we saw this one when the baby is held under its arms with bare feet touching a flat surface. It will make step-like motions that look like coordinated walking. Swimming reflex, we didn't see this one. When the baby is put face down in the water, it will lift its head and make well-coordinated swimming movements. The Babkin reflex: when both the baby's palms are stroked at once, the mouth opens, eyes will close, the neck will flex, and the head tilts forward. The Babinski reflex, we saw this one. He was playing with the baby's foot. When the sole of the baby's feet are stroked, the toes will fan out and the foot twists in as if to grasp a branch. And for some reason, I'm showing you a picture of my son playing indoor soccer. This was in Denver, and I can't remember why I put this picture in there. And there's my grandson again, Mr. Dirty Guy. Newborns are able to demonstrate their unhappiness by crying, flailing their arms, and stiffening their bodies. When babies need something, they cry. When they are feeling sociable, they smile or laugh. When their emotions are responded to, they react in a similar manner when the emotion occurs again. Researchers have distinguished 4 distinctive cries that caregivers learn almost immediately. The hunger cry, of course, tells you that the baby's hungry. This is a rhythmic cry that doesn't have to be associated with hunger, but it means pay attention to me. It's actually what it means. The angry cry is similar to the hunger cry, but with more air force through the vocal cords. A lot of times we will not respond to the angry cry. The pain cry we always respond to, and even somebody who's never been around a baby will respond to the pain cry. It's instinctual in humans. It's a sudden onset of loud crying with an episode of breath holding. And if you ever heard this, you would respond to it even if you've never had a baby or been around a baby. Frustration cry: 2 or 3 drawn out cries with no breath holding. And of course, this is another one that a lot of people will not respond to naturally because you recognize it as not danger. There's no danger. The pain cry is a danger cry, and everybody responds to the pain cry. Babies will sleep 16 to 18 hours out of every 24. Unfortunately, they only sleep in 4-hour sleep cycles, so rarely sleep throughout the night. The baby will not begin sleeping throughout the night until they are 3 or 4 months old. Approximately half of a neonate's sleep is taken up with REM sleep, a sleep pattern that mirrors being awake. REM sleep will decrease as a baby ages. At 4 months, the baby will only be in REM 40% of the time. By 1 year, the baby will be close to adult levels of REM at 25%. While most children will sleep peacefully through the night, many children will have terrifying dreams toward the morning, and that will wake them up and not allow them to go back to sleep. These are nightmares, and they occur in REM sleep and afflict females more frequently than males. Another sleep affliction is night terrors. Night terrors occur early in the sleep cycle. during the deepest sleep. They occur most often to boys, and the child is difficult to wake and will not remember the incident in the morning. When my grandson was born, I went down to take care of him his first 2 or 3 months of life. I was helping my daughter. It was really kind of interesting because this is the happiest baby you ever saw, never, hardly ever cried. But sometimes he would just wake up from screaming from whatever he was dreaming about. Sleepwalking is another problem that children sometimes will have. Sleepwalking occurs during the early night in deep sleep, so the child is hard to wake and will remember nothing in the morning. Bedwetting or enuresis is a common problem with many children after they are potty trained. About 25% of 4-year-olds will wet the bed occasionally, more boys than girls. It seems that bedwetting tends to run in families. Sudden infant death syndrome, or SIDS, formerly called crib death, is the third leading cause of death for infants under 1 year of age. However, numbers of deaths have decreased by 70% since the movement to have caregivers put their babies to sleep on their backs. 2,827 babies died of SIDS in 1994. In 2018, there were 1,300 deaths due to SIDS. SIDS is a leading cause of death after the neonatal period and occurs most often between 1 and 4 months of age. Factors in SIDS seems to be exposure to tobacco smoke and sleeping on their stomach. Temperament is a person's characteristic, biologically based way of approaching and reacting to people and situations. The New York longitudinal study, begun in 1956 by Thomas, Chess, and Birch, led to the pioneering study in temperament. There are 3 categories that they discovered: easy, difficult, and slow to warm up. 40% of the children in the New York longitudinal study were easy children, generally happy, rhythmic in biological functioning and accepting of new experiences. 10% were difficult children, more irritable, harder to please, irregular in biological rhythms, and more intense in expressing emotions. 15% were slow to warm up children, mild but slow to adapt to new people and situations. 35% didn't fit into any one category neatly, and so luckily, I guess, easy children were the highest category. The match between the child's temperament and the environmental demands and constraints the child has to deal with is known as goodness of fit. Trouble may occur if the overly active child is expected to sit still for long periods of time, a slow to warm up child is pushed into new situations, a persistent child is constantly taken away from absorbing projects. So a lot of times the child is going to act like the child is going to act, but the parent has an opposing attitude toward how the child should react. That's usually the problem. Temperament can be measured using the parental Rothbard infant behavior questionnaire. Researchers have found temperament largely inborn and probably hereditary. Temperament is fairly stable. Reevaluation at 7 years yielded very similar results as were obtained at birth. Temperament can change during the early months in response to parental attitudes and treatment. The shyest children accounted for about 15% of the sample in the study in New York. They tended to have blue eyes, thin fat faces, allergies, constipation, and unusual fears. The boldest children, 10 to 15%, tended to be energetic and spontaneous. Inhibited children that were allowed to be so tended to stay inhibited. Now, in some cultures, being inhibited is preferred, and being shy is, being bold is the way that they want their children. Like in Canada, Among Canadian inhibited children at age 2, their mothers tended to be punitive or overprotective. The children tended to be seen as incompetent, immature, and unlikely to accomplish much because they were inhibited. They were shy. Among the Chinese inhibited children at age 2, their mothers were more accepting and encouraging, even though the children were more inhibited than the Canadian children. In China, inhibited and shy children are socially approved. Patterns of growth. Children grow faster during the first 3 years, especially during the first few months, than they ever will again. This rapid growth rate tapers off during the second and third years. By 5 months, the average baby boy has doubled his birth weight, and he will triple it by 1 year. By his second birthday, a boy will only add 5 more pounds to his weight. And so the first year of birth, first year of life is has the highest growth rate that the individual will ever have. A boy's height will typically increase by 10 inches in the first year to 30 inches. They will gain 5 inches in height the second year to 3 feet tall. A baby begins teething at 3 to 4 months, but they typically don't emerge until the 5th or 9th month. At 1, they will have from 6 to 8 teeth. By 2.5, they will have a mouthful of 20. And there's the little guy with his teeth. No, he doesn't have a Coca-Cola. He stole his uncle's, his great uncle's Coca-Cola can. There's the Coke back here. Oh, wait a minute. All right. This is the Coke back here. He stole it off of this thing. He didn't steal the Coke. He stole the Coke can. Of course, the Coke can is empty. My brother is a Indianapolis Colts fan, and the little guy, and he thinks he got away with something. You can see from the mischievous look on his face that he thinks he got away with something. In the womb and after they are born, children develop from head to tail. This is known as cephalocaudally, and from the inside out, and that this is proximo-distally. The head and the brain are the largest thing about a developing fetus and a newborn. At 2 months gestation, it takes up 1/2 of the body length, and we're going to see a picture of this in just a second. At birth, it takes up 1/4 of the body length. As adults, our heads are about 1/8 of our body length. And here is a chart. As you can see, the baby's head is about 1/2. Here is the newborn, and here is the adult at 1/8 of the body length is the head. And here's a little boy, and you see exactly the same thing. There's 2 months, half of the body length, 1/4 of the body length at birth, and here is 1/8 of the body length at the adult height. Influences on growth. Genes interact with the environment. For example, nutrition and living conditions impact general health and well-being. Well-fed, well-cared for children grow taller and heavier than less well-nourished and nurtured children. Better medical care, immunization, and antibiotics have led to better health. Bottle feeding babies did not become possible until the 17th century in Europe. The water was contaminated in Europe, so it was impossible for them to bottle feed. I guess they could have fed them. No, there was tuberculosis in the cattle, in the milk. Before that time, if a mother didn't want to breastfeed her own baby because of inconvenience or she was afraid of sagging breasts, she would find another woman and have her breastfeed for her. This woman was known as a wet nurse. In the 19th century, an increase in infant deaths was blamed on wet nurses and bottle feeding. In the 1920s, bottle feeding became popular and didn't go out of vogue until the 1970s. My first child was born in 1969. My wife didn't even consider breastfeeding that child, so we bottle fed my daughter. And then when my son was born in 1972, By this time, leche, the idea of breastfeeding, had come into vogue, and my wife breastfed my son. So in 1969, no way, Jose. And in 1972, she did breastfeed the child. Unfortunately, she left about 9 months, and my son wasn't weaned yet. So that was a bit of a trauma right there after she left. Nourishment: breast milk is almost always the best food for newborns and is recommended for at least the first 12 months. Parents can avoid obesity and cardiac problems in themselves and their children by adopting a more active lifestyle for the entire family and to breastfeed their babies. At birth, the brain weighs about 25% of its eventual adult weight of 3.5 pounds. By age 3, the brain will be 90% of its total size. By age 6, it is almost at its adult size. Building the brain's maturation takes much longer than was previously thought. Brain growth spurts coincide with changes in cognitive behavior, such as the learning of language. You learn language by about age 12, and at that point, of course, those language skill neurons are pruned from the brain. Depending on the environmental stimulation, of course, the brain grows differently from different stimulation. The specialization of the hemispheres is called lateralization. The left side of the brain is where we process language, and the right side of the brain is our physical self, our visual and spatial knowledge comes from the right side. The brain represents 70% of the weight of the nervous system. The occipital lobe is where visual information is processed. It's right behind the eyes. The temporal lobe, hearing and language, it's right behind the ears. The parietal lobe is touch and spatial information. That's right on top of the head. The frontal lobe is where the higher level thinking, such as speech and reason, takes place. And this is right where your forehead is. The role of experience: smiling, babbling, crawling, walking, and talking are possible due to rapid development of the brain, particularly the cerebral cortex. Plasticity is the fact that the brain is modifiable. Throughout early life, the brain is creating more and more complex neuronal pathways. So the more stimulation the brain gets, the more pathways it creates. Even before birth, the brain is integrating neuronal coordination of muscle groups, a process known as integration. At the same time, select neurons are being developed to have a specialized structure and function, a process known as differentiation. When neuronal cells' functions are no longer needed or no longer used, cell death occurs and the body prunes the excess brain cells. Molding the brain: the role of experience. Early experience can have lasting effects on emotional development and the capacity of the central nervous system to learn and store more information. Sometimes corrective experience can make up for past deprivation, and we have seen that in developmental problems. Myelin, a fatty insulating substance, begins about halfway through the gestation in some parts of the brain and continues into adulthood in others. This accounts for improving abilities at various times during adulthood. Milestones of motor development: babies first learn simple skills and then they combine them into increasingly complex systems of action. Humans begin to walk later than other species, possibly because babies' heavy heads and short legs make balance difficult. One test that has been developed to chart motor development is the Denver Developmental Screening Test that charts a child's progress and compares it to other children of similar age and gender. How motor development occurs: maturation in context. According to Thalen, normal babies develop the same skills in the same order because they are built approximately the same way and have similar physical challenges and needs. Not until babies can get around by themselves do they learn from experience or from a caregiver's warnings that a steep drop-off can be dangerous. If there are chances to explore their surroundings, motor development is more likely to be normal. Some cultures actively encourage early development of motor skills. Giselle concluded that children perform certain activities when they are ready, and training gives you no advantage whatsoever. Findings do not indicate whether changes in the brain or in muscle strength or both are involved in motor development, but they do suggest that interaction of biology and environment. Touch and pain. Touch seems to be the first sense to develop. Pain experienced during the neonatal period may sensitize an infant to later pain, perhaps by affecting the neural pathways that process painful stimuli. So touch and pain are the first two of the first senses that the baby develops. A preference for pleasant odors seems to be learned in utero and during the first few days after birth. A preference for the fragrance of the mother's breast may be a survival mechanism. Newborns' rejection of bitter tastes is probably another survival mechanism, since many bitter substances are toxic. Hearing is functional before birth. Auditory discrimination develops rapidly after birth. Hearing is a key to language development, so hearing impairments should be identified as early as possible. When we were stationed in Germany, we had a neighbor, and their little boy was 3 years old and he hadn't learned to talk yet. And they had him checked over and over and over again. The father was not real happy about medical things, even though he worked in medicine. Finally, they took him in and had his ears checked, and it turned out that he had minor ear infections, but they had filled his ears up with fluid. So once they put the tubes in his ears and drained all that fluid out, he started talking. Before he could talk, but it sounded like he was repeating sounds underwater. It was really kind of weird. And I was the one that convinced him that he needed to have his ears checked. He said that he had had his ears checked once before, but I'm guessing that he wasn't telling me the truth. And I convinced him he needed to go in and have that taken care of. Vision is the least developed sense at birth. Vision becomes more acute during the first year, reaching the 20/20 level by the 6th month. Binocular vision is where the individual uses both eyes to focus. This leads to the perception of depth and distance developing at 4 to 5 months, and at that point, the baby will not crawl over a drop-off. And that is the end of that. I apologize for my barking dog. I'm going to go throw her outside right now. So I'll talk to you guys